Well, the parent company of the two hospitals whose computer and phone systems failed last week now admits it was a cyber attack.
But Tenet Health did not name hospitals hacked or say if the personal information of any patients or workers was breached.
Contact 5 investigator Dave Bowman joins us live with the very latest on the investigation tonight.
Jay, Kelly, we're learning more about what happened 6 days ago inside of St. Mary's Hospital when the cyber attack took its computer systems down. Wednesday, August 20th, 6:04 a.m. at St. Mary's Medical Center, nurses received this text. Multiple markets are reporting the loss of network and telecom services. 9:07 that morning, please do not use any systems even if it appears to be working. Later that morning, all users must log off and turn off all computers. At 5 that afternoon, St. Mary's Medical Center is in full downtime mode. The next morning, Thursday at 6:30, the text, all computers should remain turned off. They should not be turned on for any reason. Cybersecurity expert Alan Crowett says the damage had been done.
Even if you stop all email coming in, it's already inside the network and spreading.
At that point, EMTs from West Palm Beach and Riviera Beach were diverting stroke patients and pregnant women to other medical centers. Under federal law, hospitals have 30 days to report a cyber attack. Medical ethics expert Ken Goodman of the University of Miami's Miller School of Medicine tells Contact 5 hospitals should tell the public as soon as possible.
Institutions that want to get ahead of it, that want to make sure that they're continuing to signal that they are trustworthy, are going to get ahead of all of these things.
Contact 5 has learned the attack took down phone and computer systems in at least one other state. In its news release, Tenet does not reveal which hospitals in its nationwide system were hacked or if any of its other 3 hospitals in Palm Beach County were affected. Tenet also did not say if private, personal information of current and former patients and workers were breached. WPTV also reached out to numerous federal and state agencies, but did not get a response. Right now, we still don't know the nature of the hack. Was it ransomware, for instance? And who or what is behind it?
Everyone is at risk, and it's important to be able to say, we owned it, we're working on it, here's what we've done, we've obeyed the law, and here's what steps we're going to take to make sure it doesn't happen again.
We wanted to know why Tenet Health did not say if the personal information of patients or workers was compromised. Our calls and emails were not returned. The last communication we received from the local hospitals Friday when a Tenet spokeswoman called a patient's concerns preposterous. Contact 5 investigator Dave Bowman, WPTV News Channel 5.